Welcome back. I'm Paul Cicala. The drug fentanyl is killing people in the El Paso and Las Cruces area at alarming rates. As officers continue to crack down on drug dealers, more people who've lost loved ones to fentanyl are also joining the fight. I caught up with Jennipher Talamantes Guerra, a grieving mother whose son tragically died from a fentanyl overdose, as she continues to raise awareness about the dangers of the drug in order to help prevent other parents from experiencing the loss of a family member. Jennipher Talamantes Guerra places a picture of her son, Jacob, alongside of his grave, exactly 4 years after the fatal fentanyl poisoning.
They told me that they had found my son deceased in a hotel.
Jennipher opens up about the day, April 24th, 2020. She received the phone call.
His so-called friends left him there to die. He had very little fentanyl in his system, less than 2 milligrams.
But enough to be deadly after Jake thought he was taking a Percocet, but the counterfeit drug was laced with fentanyl.
One pill can kill. That fentanyl is extremely dangerous.
Tawanda Thorne James, special agent in charge for the DEA El Paso division, tells me traces of fentanyl are commonly found in prescription drugs that may derive from the streets and not the pharmacies.
That you should not take a pill that has not been prescribed to you by your doctor or pharmacist. Since the death of Jake Talamantes, just 25 years old, Mom Jennipher has begun the nonprofit called Fighting to Save Lives in the 915 to not only pay tribute to her son's life, but to reach out to parents through fentanyl awareness programs.
It's so important that parents become aware of the dangers of fentanyl and speak to their children.
Warning families that fentanyl deaths aren't just relegated to drug abusers on the streets, something echoed by Special Agent Thorne James, who says parents should
advise your children on the dangers of social media, because this is what they're utilizing. It's a one-stop shop, so if you have a phone, then you have a drug dealer.
DEA laboratory testing reveals that 6 out of 10 fentanyl-laced fake prescription pills now contain a potentially lethal dose of fentanyl. And Talamantes tells me that it's not uncommon to see college students taking certain drugs they think might be over the counter that is obviously laced with that fentanyl. And it makes it that much easier for us living along the border in the El Paso area to see drug dealers easily transport fentanyl into the United States.
It's not that they're drug addicts. They just took a Xanax for anxiety because they ran out of their Xanax pill and a friend gave them a Xanax.
They happen to be laced with fentanyl.
Laced with fentanyl.
People are being poisoned by fentanyl and they don't even know that they're taking it. They don't know that it's in every drug imaginable. They don't know that it's in cocaine, that it's in methamphetamine, that it's in marijuana.
According to the El Paso County Attorney's Office, deaths from fentanyl have risen gradually from 75 in 2021 to 79 in 2022 and 96 in 2023. Southern New Mexico is also seeing a rise in fentanyl-related deaths. According to the New Mexico Department of Public Safety's High-Intensity Drug Trafficking Area Program, in 2021, there were 57 deaths linked to fentanyl. In 2022, the number remained the same with 57, and in 2023, it rose to 61 people killed from fentanyl.
There is demand for the fentanyl, and our priority is to save American lives. So we continue to focus on our outreach.
And putting the pressure on cartels that control the fentanyl distribution, whether it be in Mexico, across the Rio Grande, or on this side of the border here in southern New Mexico and the El Paso area. Some strategies appear to be working, at least in the Las Cruces area, where the handing out of Narcan, the brand name for the drug naloxone that can help revive someone who may have overdosed from fentanyl, is helping to keep the deaths from having such a marked increase as we've seen nationwide. Here's a graph released by the New Mexico Department of Public Safety's High-Intensity Drug Trafficking Area Program. As you can see, from 1999, when talking about national drug-involved overdoses as a whole, there were less than 20,000 in 1999, and the numbers have steadily grown over the last 2 decades to a whopping 106,699 deaths associated to drug overdoses in 2021 nationwide. The yellow line in the middle of the graph represents the number of deaths of males, and the red, females, whose numbers are a bit less. If you could give a direct message to people who are dealing fentanyl to youngsters out there, what would you tell them?
What if you were killing one of your own children? They don't know the pain that they cause us parents who are losing our children and our family. And not until it happens to them, then they're gonna feel the pain.
The pain of a mourning mom's memories of that devastating day.
It still seems like it was just yesterday, so it doesn't get easy. It's still difficult.
For Jennipher Talamantes, Jake's dad, Jesus, and the entire family, as the fentanyl fight furthers forward.
In Jacob's memory.
If you'd like more info on the nonprofit created by Jennipher Talamantes Guerra in memory of her son Jake, I have a link in my article on KVIA.com. Also, get this, Jennipher Talamantes is heading to New York next week to raise awareness on this issue and honor lives lost to fentanyl, like her son Jake's. She tells me her son's picture will also be featured in Times Square on Wednesday during a special ceremony. That Wednesday, August 21st, is also National Fentanyl Prevention Awareness Day.